Hey, it's Victoria Field, co-host of Metabolic Health Summit. We are going to try this again, take two. For those of you who are joining before, thank you for sticking around. But we are going live today to talk all things keto with my co-host, Dr. Dominic D'Agostino, and Dr. Angela Poff unfortunately can't join us today, but I'm really excited to kick off this live because we're going to be talking about some important topics. And let's see, Dom is in here now. If we can't get this to work today, we might have to go ahead and hop on over to Instagram because it's my friend most of the time. Let's see. Says it's adding. So fingers crossed Facebook wants to cooperate. Yay!
Wow,
Oh my
I
goodness.
did the exact same thing.
It's
So I don't
so
know.
funny. I don't know.
I
It's
do a
almost,
little
I
bit.
was saying it's almost like a science for some reason. Facebook and Instagram can be challenging. Yes.
Yeah,
How are you?
good, very good.
Good, good. I'm excited to kick off today's live. I know Dr. Poff couldn't join us, but for those who are just watching and joining in, Dr. Dominic D'Agostino and Dr. Angela Poff are my co-hosts for Metabolic Health Summit, but they're also scientists at the University of South Florida. So I'm excited to have you on today because we're going to talk about some interesting topics, one of which is ADHD. So it's ADHD Awareness Month. It's also Breast Cancer Awareness Month. So we're going to kind of briefly touch on those and then talk about some exciting things that you've got going on with ketone technologies and how we're, really trying to encourage young scientists to come to Metabolic Health Summit because that's where collaboration happens. So for those who are just jumping in here, I want to mention real quick, we're going to give one general admission ticket away. That's going to be announced on October 21st. So if you're watching, share this live, go ahead and like this live, comment, engage, because that's how you enter to win a ticket, which is worth nearly $500. We've got some exciting things coming to Metabolic Health Summit. JP Sears, which I know, Dom, you're very familiar with his videos. Yeah, he's
Absolutely.
coming. He's going to be performing stand-up comedy at our gala dinner that supports the Charlie Foundation, Max Love Project. We've also got the Keto Awards. You can find out more on ketogenic.com about that. But let's kick off some information. First of all, what do you guys have going on? For those who are just jumping in and might not be familiar with the incredible work that you guys are doing in Florida, what's the latest going on in the lab for you guys at USF? I know we periodically do these lives where we can get some updates and you've got a variety of things happening, but if you want to explain what's the latest and greatest.
Yeah, well, we're parallel processing a lot of projects at the moment. Doing Angela's very busy, heading up, spearheading the cancer research program that we have. And we're looking at developing sort of therapies in line with the Press Pulse protocol. And that is basically using a multifactorial sort of therapy to manage cancer. And we're looking at different tumor models. We have a very exciting publication sort of in the works right now that was submitted investigating or sort of summarizing the results of Dr. Andrew Kutnick, his research dissertation, which looks at cancer cachexia, characterizing a model of metastatic cancer as an incredible model of cancer cachexia, and we're excited to get that work out. The underlying sort of message with the work that has been done is looking at ketone bodies, nutritional ketosis and ketone bodies as a means to mitigate the factors that are associated with muscle wasting or cancer cachexia. So that has been one of the bigger topics. And that was spearheaded really by Andrew Kutnick, Dr. Kutnick.
Right.
Looking at, we've talked about in the past how ketones are not only energetic fuel for cells, especially the brain and the heart, but also epigenetic regulators. And we are continuing with our studies on Kabuki syndrome, and we're continuing to breed up mice and get those mice into experimental protocols where we're evaluating the effects of ketone bodies on Kabuki syndrome mouse model and we're doing a variety of behavioral studies to assess the effects of nutritional ketosis through supplementation in this mouse model that we got from Johns Hopkins. Dr. Bjornson was kind enough to donate that to us. And then probably the biggest project that we have right now is funded by the Navy, the Office of Navy Research, and developing ketone supplementation as a way to enhance safety and resilience in extreme environments, being high oxygen environment. So we got a lot of other little things going on, but that's kind of like the gist of the major projects going on
Yeah,
at the moment.
a lot of things in the works, and things that are so important, just in terms, I mean, issues like cachexia. I mean, if, some of Dr. Kutnick's work is just incredibly important when it comes to things like cancer. It's exciting to see where the research is really headed. And I know it's going on all over the world, and it's interesting because I still come into contact with people where they hear the word keto and they're like, oh, I've heard of that diet. And as soon as you kind of talk about sort of the backstory and how it's been around since, the 1920s and where the research is expanding to, it's an exciting time. And I think that, I mean, that's our goal at Metabolic Health Summit, is to really be able to bring all the people doing the work in the same room for collaboration, but also education. So we can really push this forward and people can understand this is far more than the fad. There's a lot of potential applications here. One of them that I think is really interesting and that I wanted to touch on, just generally speaking, because there's still a lot more work. I mean, it's very, very in its infancy when it comes to the neurodevelopmental disorder ADHD, which is interesting because some of the research is suggesting that mitochondrial dysfunction, could have sort of a role in ADHD, which could also suggest that there's a metabolic component to this, which, first of all, sort of maybe explain, for those who are watching that might not be familiar with what even metabolic disorder might mean, and, how the ketogenic diet might potentially, through ketone metabolism, play a role as a possible tool for ADHD. Now, I know the research is still very thin, but, from your perspective, what are your thoughts on that?
Yeah, well, over the years, I've gotten a lot of emails about this. And some of it to the extent people are asking questions. Can nutrition, can diet in particular, can the ketogenic diet or supplements like omega-3s help my child with ADHD? And then that was early on. And over the years, I've gotten some compelling documentation, before and after videos, for example, report cards, conversations with parents. Diet undoubtedly helps. A poor diet, I think there's some studies showing that high refined sugar is associated, it's a bit of a weak correlation, but associated with ADHD-like behavior and hyperactivity. But over the years, yeah, I've gotten, compelling data or compelling, reports from parents, and even videos and some documentation that they have. So maybe some case reports in line, and other disorders like things like autism and Angelman syndrome, and it's associated with symptoms or behavioral characteristics that are similar to ADHD. And we sort of put a lot of the research into a recent publication that is, well, here's the title here, you can read. Therapeutic potential of exogenous ketone supplementation induced ketosis in the treatment of psychiatric disorders. And in that paper, I mean, we talk a wide variety of things, but the underlying sort of message is that the pathophysiology of many disorders, psychiatric disorders and behavioral disorders, is really closely associated with brain energy metabolism, which is intimately linked to the neuropharmacology of the brain and the balance of neurotransmitters in the brain. And also, if brain energy metabolism is compromised or dysregulated in any way during development, that you can have developmental consequences from dysregulation of brain energy that can lead to a developmental path that favors hyperactivity and some of these things that we're seeing. So there could be environmental factors. There's a lot of things we don't really know what's contributing to it, but there is. Could be, environmental for sure. But I think, nutrition and ketogenic diet may play a role in it. And that's because ketones function as an energetic stabilizer for the brain. When you are on a ketogenic diet, you don't have wild fluctuations in glucose and insulin and things that can alter fluctuations in the brain. There is, the GABAergic system. GABA is more of a calming neurotransmitter relative to glutamate. Glutamate contributes to hyperactivity, and you make more GABA from glutamate. So you are taking a hyperactivity neurotransmitter and enzymatically converting it to a brain stabilizing neurotransmitter. And being in ketosis does that. Not only the ketogenic diet, but more recently, elevating ketones by virtue of a ketone supplement can activate GAD65 and I think 67. So it's an enzyme that helps you get a neurotransmitter that contributes to hyperactivity to develop more of a calming GABAergic. And that's an area that we're focusing on. And reactive oxygen species too.
Right.
Oxidative stress can be lower on a ketogenic diet, and mouse models, I know, and there's some human data, they're looking at this, that oxidative stress markers are higher in the brain of people that are hyperactivity. And in animal models, this, is elevated, and we know the ketogenic diet and ketones can attenuate oxidative stress in the brain. So there's a lot of different, factors that could influence ADHD, and the ketogenic diet tends to mitigate things that could go awry. But it's an area of, where mouse models provide most of the data, and human studies are ongoing on this.
Right.
And so it'll be interesting to see where that goes.
Yeah, it is really interesting because I think ADHD is the most common mental disorder actually with people who suffer from epilepsy. And obviously the ketogenic diet has been used in epilepsy for so long, and you often hear those who transition onto a diet that might be facing seizures do experience some of these other kind of cognitive benefits alongside that. So it's an exciting thing, and something we're going to be going into. Last year, we actually covered autism specifically. I know typically when ADHD comes up, questions of autism and a variety of other neurological disorders, but last year we covered autism as well as epilepsy, and ADHD is something that we'll definitely be bringing up at Metabolic Health Summit. For those who are watching and haven't attended the conference, we bring in some of the top experts on these subjects, specifically like Dr. Eric Kossoff is coming, Dr. Zhang Ro. If you head on over to metabolichealthsummit.com, you can check that out and see some of the videos from last year too on this topic. And I want to mention, if your child does suffer from something like this, it's super important to check in with your physician before starting anything, especially when it comes to metabolic therapy specifically. So, but it's exciting to hear where this is headed. And
nutritional status too. I like to mention that a doctor recommended that studies this, that we're in collaboration with, said that omega-3 levels are the polyunsaturated fatty acid levels, particularly the omega-3 levels, are lower across the board in kids that have ADHD. So I think omega-3 supplementation as a monotherapy has been shown to, and there's more than one study I think has been shown to improve symptoms of kids with ADHD, and also cognitive scores. So that's a single, nutritional factor. So perhaps, a low carb, a ketogenic diet that's rich in omega-3s and fish. But I know omega-3s as a monotherapy, sort of nutritionally, and identifying this was, it was identified that kids that have this, I think it's about 450 to 350 patients showed nutritional status of omega-3s was lower. So,
wow.
So I think there's potential there. So I would advocate for parents to do a nutritional status test too,
Right.
which can be done. Maybe not your primary doctor. You might have to reach out for that, but that's
dig a little.
Now.
Certainly start with your physician, and oftentimes most physicians are very open to, exploring that further. And I think that says a lot about the patient too, asking for certain things and looking into things themselves as well in the process. And especially something that's simple, like, getting in more fish and things like that. I know that's a huge part of my diet. I actually had ikura, the salmon roe for lunch, specifically because I know how incredible it is for the brain. But I digress. Let's talk about breast cancer, just at least generally. This is a disease that really accounts for over 40,000 women's lives each year. And it's still something that I think is a pretty big problem. And there's certainly genetic factors that do play a role. But I do think there's a big influence of lifestyle factors as well. It's really interesting. Research is actually showing that obesity specifically, and I know we've talked about this in a post on Metabolic Health Summit platforms, but obesity can actually increase a woman's risk of breast cancer by about 60%. So just looking at maybe not even the specific cancer type per se, but the possibility between how obesity might be linked to cancer, I think is really interesting. It kind of ties in all things like insulin, insulin sensitivity and a variety of other things. Can you explain that relationship maybe? Just as it is Breast Cancer Awareness Month, we're really trying to share more information around that.
Yeah, I mean, you had, sent me the question about 5 minutes before, so I did a quick look on PubMed. It is a topic that we're very interested in. I mean, we have a breast cancer model, and no doubt, I think it's pretty much acknowledged now that obesity, type 2 diabetes, which is associated with chronic inflammation, systemic inflammation, is a driver for breast cancer. I mean, it produces an environment where if you have breast cancer, and we are sort of cancering all the time, and our body can recognize it, but if you are creating a fertile environment for cancer, which means inflammation, hyperglycemia, high insulin, and insulin associated signaling. When cancer does occur, it's sort of seeding a fertile environment for cancer to grow. And I would describe type 2 diabetes, obesity as really providing that sort of fertile environment for this to go, to grow. And I think, nutrition and exercise too. And exercise is something that we haven't put as much time and effort into studying, because it's a little trickier to study in mouse models how to prescribe it, and not, you can forcefully make mice exercise, but there's voluntary and involuntary things. But I think the combination of nutrition and is probably first and foremost one of the most important for prevention of cancer, and exercise too. And that those two things together optimize your metabolic health and a variety of biomarkers which are pathophysiologically linked to getting cancer or preventing cancer if they're optimized, and also the outcome that you'll have, during cancer therapy. The outcomes will be much better if you can lose weight, get a number of biomarkers under control, especially your blood glucose and insulin are really key for cancer patients to really focus on that. If you've had cancer in the past, and a lot of people communicate with me that have had cancer, and they ask, well, what can they do to prevent it? And I think there's a variety of things we could do dietarily to do that.
Yeah, it's definitely interesting topic that it really brings up sort of some of the choices and some of the day-to-day things that we can do. Obviously, there's a lot more work to really understand, like, what does that mean in the future? Like, your choices now, what does that mean in the future? And it's really a hard thing to study. But I mean, when it comes down to it, thinking about eating a healthier diet, exercise, these are all positive things that we all know have proven results. You can just see it simply in a simple blood test. So it's a really exciting area that, to really understand. The research is showing that obesity can link to that risk, such an increase, like 60% increase, that we have some really powerful choices that we can make day to day that might help when it comes to prevention. So really fascinating topic. And I know Dr. Thomas Seyfried is going to be discussing this more. Dr. Chris Smith, who specifically focuses on brain cancer, is going to be talking to this a little bit, what he's seen personally. You guys in your lab as well have such incredible information. And really, if you search for some of the research right now, you can see there's a lot going on when it comes to clinical trials and things. It's exciting to see. And you guys are doing some really incredible, not just research, but work with ketone technologies. This is something that you and Chilla created to be able to really support the research and a variety of things. If you want to talk a little bit about your mission with Ketone Technologies and how you're really going to be bringing something great to Metabolic Health Summit. You did it the first time last year to really encourage junior scientists to put their work out into the world. If you want to explain what you guys are going to be doing at Metabolic Health Summit 2020.
Sure. Thank you, Victoria. Yeah, I mean, we developed this company for a variety of different reasons. Education, first and foremost, and research, we think is so important in this topic. And that's why, I mean, Metabolic Health Summit is probably, there are a number of conferences out there, but when it comes to getting the word out, getting the science out, and getting the science of nutrition, not just ketones, and of just metabolism in general, into the general public, into clinicians, scientists, and that leads to application. Like all this information, it's no good if we don't put it into application, right? So sort of the line of the company is really moving the science into application, moving the science of ketones, moving the science of metabolic optimization into practice. So our company has been mostly working on the front of with NASA, sponsoring NASA Extreme Environment Mission Operations and the science, and then lots of different studies that we're doing with that. But we're really passionate and interested in supporting young scientists, in particular, as it pertains to Metabolic Health Summit, to scientists that are presenting a poster and making available a travel award to them based upon the research that they're doing. And
that's awesome.
we're excited, as last year, we're excited to be able to read the literature or read their poster and talk with them and really support young scientists that are in this field. So that's a big mission that we have.
That's great. And it's so important to encourage that discussion and involvement because that's where our future is headed. And these are the people that are going to carry it. And so at Metabolic Health Summit, for those who don't know, we do have an international scientific poster session where you can submit abstracts, whether that's preclinical, clinical, even case studies. And so we encourage junior scientists to do that because you have a chance to win this travel award from Ketone Technologies. And you can find more info about this on metabolichealthsummit.com. And as well, Ketone Technologies, I believe, ketonetechnologies.com. Right, is your website as well, and in addition to that, we're also offering 20% off general admission tickets to poster presenters who have been accepted for our poster session. So you also get a discount to enter. So to enter, the deadline or to submit your abstract is December 20th. And Ketone Technologies is going to be a big part of providing this great travel award to one person who's doing incredible work. So thank you guys for doing that, because it really helps continue like this momentum forward of new and young research.
We're excited to do it. And it was really a hard decision last year. So hopefully, we can get into a position where we can give more awards for subjects, for different topics. But it was really hard last year because the science, the posters were really good, and one thing that separates this conference from other conferences, not all conferences, but everybody is just so passionate and so excited to be there and share what they know and to learn. So that's really exciting just to be in that environment. And if you're thinking about going but kind of on the fence, I recommend just going all in and being there for every day, getting there early, giving yourself time to network and meet with people, because it's going to be a great networking opportunity too. And hopefully, I'm hoping to carve out a little bit of time in between things to do more networking, for us and the company and everything too.
Yeah, no, it's great. I mean, from A to Z, whether you're academic, medical professional, or just somebody who really wants to take a deep dive into metabolic health and also connect with a lot of the brands in the space that are making the application component a lot easier. You know, it's funny, when this first started, it used to be called the Conference on Nutritional Ketosis, Metabolic Therapeutics. And there was like limited brands, and it sort of was challenging if you had started a ketogenic diet, but now there's a variety of things making it much, much easier. So you can also connect with those people in our expo. There's multiple networking events. It's a ton of fun. And if you comment on this and share it, and like and all that good stuff, you're entered to win one ticket, even in the replay. So make sure you guys go ahead and do that. I have one last question for you, Dom, that actually came from somebody that's fairly relevant, because you just posted a fabulous photo of you and Chilla and your dogs. And somebody asked, said, your dogs look super healthy. What do you feed them? So everybody's wanting to know, are they on a ketogenic diet? What would you say?
Yeah, well, they eat the food actually that we eat for the most part. So we do buy organ meat, we buy liver, U.S. wellness meats. I'm like totally enjoying everything they have, from liverwurst to I had a heart burger the other day. So
Oh,
it was
nice.
ground heart meat. Yeah, and I made a burger with that yesterday. It's
They have
amazing.
the fabulous, fattiest meats I've ever tried. Just for
Yeah,
the record.
the pemmican too. It's really hard to find. I think they're the only one that I know that really has like a low carb, or carb free pemmican.
Yeah.
So our dogs eat the same foods. We buy chicken liver, beef liver, ground meat, eggs, and we give broccoli to our dogs, just a little bit of fiber. Um, but basically the same food that I eat, we just partition out them. And we do have, we buy a couple different brands of kibble, grain-free, like sort of high-quality kibble, or dehydrated, a number of different brands, that we test, that people send us. But for the most part, 90% of what they eat is kind of the same food that we eat.
Yeah.
And I think the big factor in their health too, and now we have a little bit more property to do it, is that we run them a lot.
Mm,
So they get, 2 exercise bouts each day, and sometimes in the middle of the day if we're working at home. And on the weekends, they get a lot of exercise.
that's
So
awesome.
dogs really need, and it helps the pet owners too.
Yes,
Pet
this is true.
owners tend to lose weight. If you get a pet, you tend to be healthier, because especially a hyperactive pet, because our dogs need to run for them to be calm, at
Yeah.
nighttime, or else
Yeah.
they're always jumping on us, trying to get us to go outside.
And they're probably like 6 feet tall when they jump on you. So I don't know if that's a
Yeah,
good idea.
yeah.
Yeah, no, that's a good point. Metabolic conditioning is so important. And obviously, it's funny that you mentioned like it's good for the owner too. I actually started a ketogenic diet. It was something that I was thinking about forever. But it wasn't until we started my dog on a ketogenic diet. I think I've told you this story before, specifically for epilepsy. And she didn't just transform in the form of like her seizures stopping and us getting her off medication, but like her skin, her energy levels, all these things. I'm like, well, if this is good for my dog, I should maybe be trying this myself. And same with my husband. So it's interesting how things happen. And now we're a whole keto family, and it sounds like you guys are the same. But it's something that it seems simple, but it's species appropriate, and I think that makes a big difference in the lives of our best friends too.
Yeah, physical and mental health.
Yeah,
So I think pets really love, to get your attention. So the more attention you give them and the more you're around them, I know for Chilla especially, it has a very calming effect. If we're all stressed out from work and we come home, I mean, it's like the best way to decompress is just to go outside, exercise with your dogs, be around your dogs. So that's
totally.
a big thing. Yeah.
We'll have to make Metabolic Health Summit dog friendly in the future years.
Yeah. Yeah, we were talking about that. Yep.
That'd be great. Well, thanks, Dom. I know you're super busy, and thank you all for watching. If you have additional comments, you can always post below, share this link, comment, engage, because we're going to be announcing the winner of one ticket on Monday, the 21st. And thank you for taking some time out today, Dom. I'm so excited to continue our plans with MHS. For those who haven't checked it out, metabolichealthsummit.com, and you can find all of our speakers. We're going to be announcing more soon, and we've got incredible partners in the mix too. So thanks, Dom, for the time today.
Always a pleasure. Thank you.
All
Thank you,
right.
everybody, for tuning in.
Thank you, guys. We'll see you all soon. All right. Bye.